flooded with your questions about the coronavirus, and we are working to get answers for you. Joining us now on the Eyewitness Newsline is Dr. Faiqa Cheema, an infectious disease specialist at Hartford Hospital. And Doctor, thanks for being with us tonight.
Thank you for inviting me today.
I want to ask you, first of all, what constitutes a fever for COVID-19?
A fever is a temperature above 100.5, but I want to take a minute and point out that about half of the people who are infected with this virus, at the beginning of this infection, they may not have a temperature at all. They may just present with just vague flu-like symptoms of just fatigue, body aches, just headaches, and sore throat. About less than 1% may just initially present with diarrhea before all these symptoms of body aches, myalgias, and fevers may actually start. And an interesting fact I want to point out is that information coming out of Italy and France from all the patients who are infected with this virus, people say that those patients who have tested for COVID-19, they, in addition to all these symptoms, they also present with a loss of smell and an extremely altered taste. So I thought I would just bring up that point as well.
Good enough, Doctor. Thank you. If someone tests positive and they're tested a month later, will they be negative?
That's a great question. We do know from the insights in China that viral shedding, that's what it really implies, is highest in the early course of the disease and peaks about day 5. In patients who do have mild to moderate form of this illness, the viral shedding stops at about 1 week to about 10 days. But if you're really critically ill with this infection, the viral shedding can occur up to about 2 weeks later. But at about 30 days, it's kind of a far stretch.
Doctor, will coronavirus still be around in the summertime, or will the hot weather sort of kill it off, so to speak?
A lot of people are interested in the answer to this question. The coronavirus doesn't behave, we don't think it'll behave like the flu. The flu is kind of unique that by the time the warmer weather comes around, it just kind of dies down. The coronavirus is a new virus. We don't know much about it. We're hoping that it may behave like the flu, but we just don't want to make that assumption. We're going to just be extra cautious. We'll continue to practice social distancing and see how things go as the warmer weather comes around.
Dr. Faiqa Cheema from Hartford Hospital, we thank you so much for your insight tonight. Thanks for joining us.
Thank you for having me.
Stay safe over there.